second molar, you have to put the implant in here more. Also, I'll talk about the premaxillary area. Two parallel line perpendicular to the middle line is drawing the canine, tip of canine and the face of incisor. So distance between these two lines less than 8 millimeter is scale dentition. And the 8 to 12 is avoid dentition. And taper, it means to over more than 12 millimeters. So if the patient have the premaxilla under the 8 millimeter, you can use the 2 implant for 6 unit bridge. If the patient have 8 to 12 millimeter, you have to put the 1 more implant in the anterior side. Like this. You can see here, this patient have ovoid arch form, like this. You can see here the tip of canine line and incisor face line. It almost 8 to 12 millimeter. So I use only 2 implants for 6 unit bridge the fracture in the central area. Like this. So I put 1 more implant in here. Like this, the very thin alveolar bone, and a drilling, and there is a fracture cortical bone in here, so re-drilling the other side, and put the very thin fixture here, like this. Yes, like this. So I make the crown 6 unit bridge, like this. The crown, this area only support. So after that, the patient have good result. No more fracture in here. So when you make the crutch treatment planning, you have the premaxillary area, the diagnose this area, and put 1 more or 2 more implant in here. So taper denture arch form. So over the 12 millimeter, you have to put the 2 implant in anterior side. So the treatment planning always is very important. Yeah, this is a clinical case. This is an analog method. Patient have the edentulous mandible, so we put the implant, actually 6 implant in row. And then we make the impression and make some impression blocks with pattern resin. So, and cutting in the here between implant and connected in the mouth like this, and connect together in the mouth, and take the impression like this and make the working model. And then I make the occlusal bite block and make some elevated portion for CR bite using the UCLA abutment. And I induce the patient to CR position and take occlusion, check bite. Like this, mounting in the articulator, and make inner cupping and outer metal cupping, like this. So I cantilevered a little more, just 5 and 6, 5 and second molar and first, second premolar and first molar. I connected in the mouth like this, and occlusal adjustment. And finally, we build up the porcelain in here like this. So this process is all on 6 case. Finally, I check out the bite interference in the articulator and set up in the mouth. This is a 10 years follow-up like this, and 15 years follow-up. There is no resorption on the fixture. So everything is okay. So maybe now it may be 20 years follow-up. Fully edentulous, we planning the 6 implant in upper side and 4 implant in lower side.